multiple interventions to make the food environments healthier, we realized that we were talking about equity, human rights, etc., but we didn't have a tool to make sure that equity was considered by countries when they were implementing the interventions. And that's where this collaboration started. The SHIFT framework is a collaborative effort between Uppsala University, the Karolinska Institute, and EAT, with technical and financial support from WHO, the Department of Nutrition and Food Safety. So SHIFT is a tool that is focused on technical staff, is really to help them integrate equity considerations in the process and helping them in the process to identify the considerations to make sure that the equity is integrated into the programs and the programs are context specific. So it's really to guide program designers and program managers to make sure that they don't just talk about equity, but make it real. So today I have the pleasure to introduce Dr. Naoko Yamamoto, Assistant Director General for Universal Health Coverage and Healthy Populations in the World Health Organization, who will provide some opening remarks. So now go over to you, please.
Thank you, Ruth. Dear colleagues and friends, it's my great pleasure to welcome you, all of you, to launch the SHIFT framework, shifting to equitable health and nutrition through food environment transformation. As Ruth exactly said, that this is the result of great collaboration between Uppsala University, Karolinska Institute, and EAT with support from WHO. Today, the world is not on track to ending malnutrition in all its forms. While some progress has been made in areas such as exclusive breastfeeding and reducing childhood stunting, the situation remains stagnant or worse for anemia in women of reproductive age, childhood wasting, overweight in children, and adult obesity. Increasingly, countries, households, and individuals are facing multiple burdens of malnutrition simultaneously, and vulnerable groups carry the heaviest burden. In urban cities, certain neighborhoods can have much higher prevalence of malnutrition and diet-related NCDs. Also, women and girls can be more affected than men. Global crises such as COVID-19 pandemic, climate change, and conflict have exacerbated inequities and demonstrated just how vulnerable our food systems are. Our food systems are not providing the food that is needed in an equitable and sustainable way. So food systems transformation is critically needed. Today, over 3 billion individuals cannot afford a healthy diet. This is unacceptable and represents a violation of the human rights of food. Different forms of malnutrition are often rooted in deeper inequities. So people eat what is available, accessible, and affordable within the immediate food environment. Therefore, our intervention within local food environments need to consider equity and involve vulnerable groups in decision-making processes. So only when we promote equity in food system policies can we fulfill the Agenda 2030 and SDGs promise that leaving no one behind. The SHIFT framework focuses on the intersection between food environments and human behavior using the equity lens. It is designed to assist technical staff to promote high-level commitment and coordinate multi-stakeholder processes to accelerate progress to achieving health and nutrition equity. We are pleased to share this framework with you today. The framework will support the integration of the equity into food environment transformations, and it will also contribute to our goal of 1 more billion people enjoy better health. I thank you, partners and speakers, for their contribution, and thank you all for joining this launch. So I thank you. Back to Ruth.
Thank you so much, Naoko. And now I pass the floor to Amandine Garth, professor of law at Liverpool University. Dr. Garth is an expert on the role of law in the prevention of childhood obesity and other non-communicable diseases, and a leader in protecting children from harmful effects of junk food marketing. Her presentation or her talk will focus on promoting equity in food systems through the use of human rights-based approaches. Amandine, the floor is yours.
Thank you very much, and good morning, good afternoon, everyone. It's a real pleasure to be here. Thank you for inviting me. So increasingly, malnutrition has been envisaged not only as a major global health, but also as a major international human rights concern. And this evolution in the discourse has important implications for how states around the world should act, both individually and collectively, to promote food environments and healthier food environments. And in this very short presentation, I would like to make 5 remarks that are intended to reflect on why human rights-based approaches may offer interesting opportunities to address malnutrition through food environment transformations and therefore shift to more equitable health and nutrition. Firstly, I would like to highlight that human rights-based approaches are grounded in international human rights and international human rights law more specifically, and they draw on global and regional treaties and conventions. Now, these legal rights instruments arguably have a quest for equity at their heart. We are all right holders, and the rights we derive from these instruments must be recognized. These rights include the right to the enjoyment of the highest attainable standard of health and the right to safe, adequate, nutritious food. There are many related rights I'm not going into at this stage, but I'm happy to take questions on them. Now, some conventions apply to all right holders, whilst others grant specific rights to groups that have specific vulnerabilities. For example, there is the Convention on the Rights of the Child. There is a Convention on the Elimination of Discrimination Against Women, to give 2 specific examples. And in these conventions, you will have rights that are specifically granted to these groups, recognizing their vulnerability. So, for example, the Convention on the Rights of the Child mandates that states shall uphold the best interest of the child as a primary consideration in all their actions concerning children. And this principle, which I use as an example, is particularly relevant when balancing competing rights and interests, and requires that the best interest of the child shall not be considered on the same level as other considerations, such as short-term industry profit margins. And this is where the human rights and the sustainability agendas meet. States must adopt a longer-term view to ensure that the interests of future generations are not unnecessarily compromised, and that they do so in an equitable way, recognizing that the burden of malnutrition may affect different groups, both within and beyond, within and between countries differently. Secondly, I would like to highlight that human rights-based approaches are normative in nature. Human rights are not optional. They lay down legally binding obligations on states as duty bearers to respect, protect, and fulfill the rights of right holders. In other words, a human rights-based approach is grounded in law, not in charity. And this takes me to my 3rd point. It is widely acknowledged that the obligation to protect human rights requires that states adopt a preventive approach and regulate the commercial determinants of health, including the food industry. States more broadly must address the underlying determinants of health, including the socioeconomic, commercial, and structural determinants. So harmful commercial practices must be effectively regulated. And to this effect, the interpretation of human rights should be guided by the best available evidence we have at a given point in time. For example, as the evidence regarding the impact of food marketing on health develops, a dynamic interpretation is called for so that human rights treaties and conventions that may have been adopted decades ago, well before digital marketing regulation was on the agenda, so that these treaties can evolve and remain fit for purpose to address the problem of the day in June 2022. So again, an example in its general comment number 25 on the rights of children in the digital environment, the Committee on the Rights of the Child has called on state parties to ban the profiling of children for commercial purposes. And a purposive interpretation of human rights is all the more warranted in such fast-moving policy areas as the food environment and food systems. And it is only then that all children exposed to the extraction of their personal data can be effectively protected from predatory marketing practices. Fourthly, human rights-based approaches require that states should be accountable for the effective protection of human rights. To this effect, states must set processes in place allowing right holders to claim their rights and be compensated should these rights be violated. And these processes can be either judicial or extrajudicial in nature, for example, an ombudsperson or other agency. And the more state can empower civil society, the more one can hope for change. And the principles of participation and empowerment are key principles underpinning human rights-based approaches too. So a particularly affected group should be given a voice, and the lived experiences of the members of this group should indeed be taken into account in policy development, policy implementation, policy monitoring and evaluation. And fifthly and finally, I would like to note that the principle of accountability requires that states shall not delegate their responsibility to industry actors that have vested interest in the maintenance of the status quo. A human rights-based approach puts states in the driving seat. They are the ones who are duty bearers. Under the UN guiding principles on business and human rights, industry actors have responsibility to respect human rights, but the responsibility to the obligation, the legal duty to respect, protect, and fulfill human rights rests on states. We know that multinational food companies have been increasingly implicated in the deterioration of food environments that has led to growing rates of diet-related diseases around the world. Through a suite of mergers and acquisition, some of them have acquired immense economic power. They have also used trade liberalization and foreign direct investment opportunities to increase their reach beyond high-income countries where they tend to have their headquarters. As a result, they have gained significant political influence, which they have used extensively to lobby governments to engage in public-private partnerships and thereby refrain from adopting legally binding measures, including those measures that are associated with a healthy food environment, a more equitable food environment, and that human rights-based approaches would mandate they should adopt. So industry-led pledges have flourished as obesity has continued to grow around the world, and state actors must recognize that industry operators, particularly these big multinational corporations, cannot be trusted to address the double burden of malnutrition and the resulting health inequities that have directly contributed to, both within and between countries. So I will stop here, but very much look forward to the discussion later on today. Thank you.
Thank you very much, Dr. Garda, and thank you for reminding us that human rights are not optional. That's and that profit cannot be above the human rights. And when we are talking about food, we cannot, it's our obligation to make sure that we do the right thing and protect the interests, particularly of the most vulnerable, children, women, and other populations that are vulnerable. Thank you so much. Now we are moving, we have a video. Dr. Sandro De Mayo is the CEO of Big Health in Australia and a renowned public health expert and advocate. If you don't already, I recommend that you follow him on Twitter because he frequently posts updates on health promotion in Australia and other things that I think that you are going to find very interesting. But the most important is that he's advocating for healthy food environments in different settings. And today, of course, due to the time difference, he cannot join us in person, but he left a video. So I will please ask my colleagues to play his video now.
Good morning, good afternoon, and good evening, distinguished guests, friends, and colleagues. My name is Dr. Sandro De Mayo. I'm the CEO here at Vic Health in Melbourne, Australia. I'd like to start by acknowledging the traditional owners of the land that I'm on, the Wurundjeri people of the Kulin Nation, and their elders past, present, and emerging. Well, I'll be talking about an equitable transformation in our global food environments and providing a perspective from Australia, from the work that we're doing in Victoria, and how this relates to some of the global perspectives. First of all, Vic Health is an independent statutory authority in the state of Victoria. We are one of Australia's peak health promotion and prevention agencies. We're responsible for the health and wellbeing of 6.5 million Victorians. We were originally established in the late 1980s through a hypothecated tax on tobacco, funded into an independent public health agency. Well, where we stand in 2022, 8 years from the end goal of leaving no one behind and the Sustainable Development Agenda. And in fact, today we are further in many respects from those goals and targets than we were yesterday and a year ago. We've committed to zero hunger, we've committed to universal health, and we've committed to our important goals of global sustainable development. And even from the latest estimates looking just specifically at young people, we are not on track to meet our global targets, particularly when it comes to nutrition, health, and food systems. Some of the major challenges facing our populations, one aspect and insight is our latest joint estimates, showing once again that we are not on track, in fact, in many ways, in many regards, moving in the wrong direction. And we know that the last 2 years, the pandemic, while early on it was heralded the possibility of being a great leveller, has really been the great accelerator, the accelerator of all the concerning trajectories and trends that our planet was on from a biological and ecological and a human health perspective prior to the pandemic. We've likely seen furthering of hunger, global hunger worldwide, and a deepening of global poverty. And really what we've seen here in Australia and in Victoria, based on our own series of population-based surveys informing policy and programmatic responses throughout the pandemic, is that it is fundamentally a pandemic of inequity, born from it, propelled by it, and will only ever be solved through the addressing of deep and entrenched health inequities that for a long time we had papered over, and the pandemic simply exposed, deepened, and widened. Here in Victoria, we saw that it was individuals from lower incomes, First Nations, Victorians, single parent households who were hardest hit by the direct and indirect consequences of the pandemic. And we saw diet and nutrition as a major canary in the so-called mine. We saw increases in food insecurity and populations becoming food insecure for the first time. We saw individuals and families turning to unhealthy foods and ultra-processed foods in record numbers to save money. and we saw an increase in sugary drinks consumption year on year as the pandemic progressed. And we know that the solution is not about pointing fingers or assigning blame and shame. It's really about fundamentally changing the systems and, most importantly, the environments in which people are born, grow, work and play, and in turn explore, grow, purchase, consume, and also waste food. It's the food environments in our schools, in our retail and commercial markets, in our workplaces, as well as the personal food environments in our own homes that we need to focus on in driving, in truly addressing these deep inequities that have emerged, and in really understanding and capitalising on the opportunities that are at hand. So some of the things that we have been doing, first and foremost, the addressing of health inequities through the transformation of our food environments needs to be based on evidence and based on shared norms. So one of the things that we did very quickly was to move to establish food relief guidelines based on health, cultural sensitivity and appropriateness, and environmental sustainability as food insecurity became a record challenge for populations in our part of the world. We wanted to make sure that that food was not only nourishing populations from a human health perspective, but also culturally respectable and dignified, and was going to be congruent with a healthy future for our planet. In addition, we looked at ways to increase collaboration across the food relief sector around principles of nutrition, of cultural respect, and again, of environmental sustainability. We also looked for new ways of partnering with existing and also expanding existing partnership models. One of those was the establishment of a new statewide network of local governments. Enshrined in a piece of legislation, our local governments must create health and wellbeing plans. And so we worked with local governments, now 23 in total, and soon half the state's local governments, to build their capacity and capability in local leadership for food environments transformation, in identifying major sources of inequity through complex systems mapping, and then through the development and implementation of technical-based modules and communities of practice, as well as innovation funding, able to drive local place-based solutions. We also then implemented evaluation and monitoring and evaluation, because we know that what gets measured gets done. But our leadership doesn't stop at the edge of our state, nor at the edge of our country. As an agency here in Victoria, we partnered with UNICEF and the Global Obesity Centre at Deakin to look at learnings, but also to scale learnings across our region through a partnership model. We looked at ways, developing and implementing new ways to map and monitor food environments in East Asia and the Pacific, and also looked at identifying policy options and accountability mechanisms for food environments transformation. This in turn has then informed some of our local work. Working with UNICEF and EAT, we have built a coalition of young people who have been busy co-designing together through the pandemic healthier alternative food environments designed by and for young people. And we're actually now exploring an opportunity to build a pilot of these food environments, a healthy and sustainable youth-designed food environment model, particularly for our retail sector, rolling it out through a retail-focused community of practice that we drive here in Victoria, and looking at ways that we could actually pilot that through an arts installation, again, to further discussion, build advocacy, and drive political change. But we know that innovation and leadership can't just come from us as an agency or indeed from government. We have funded over 1,000 local innovations over the last 12 months, health promotion innovations in the sports, arts, cultural, youth, and the food sectors. And this is really about acknowledging the enormous amount of strength and resilience in local communities and local leaders, and creating flexible and meaningful opportunities to resource these innovations to achieve and maintain scale. The first one there, Flourish, is a youth-led, designed capacity building platform for young agents of change in their food system. The second is a food provider, a market, a not-for-profit social enterprise that runs fresh food markets in refugee communities and social housing. And the third is a cooperative looking at disrupting food production and food environments in small communities across regional Victoria. And lastly, I want to leave you with a short video that describes a brand new program we're launching very, very soon. This is a $4 million 2.5-year investment in designing 10 new local youth-led food hubs across Victoria, really about creating local, disseminated, place-based, youth-led food environment transformation. And I'll leave this with you as a last small video, but wish you all the best for the launch of Shift. A deep thank you for this important contribution to the global science, practice and implementation of what is so overdue, a transformation in our global food environments. Thank you.
Thank you so much, Sandro. It was a great presentation, and do appreciate a lot the effort that you took to leave us that message. Integrated equity is feasible, and it's in some cases is moving forward. So, and unfortunately, due to time considerations, we cannot play the video Future Healthy Initiative, but we are posting the link on the chat. So if you want to see it after this webinar, please go and click there on the chat. And now we are moving, and it's a pleasure to introduce Dr. Meena Davidanam. I always have problems to pronounce the last name, but I think that I did it correctly this time. And she has been really instrumental in making this tool happening. She is the Associate Professor and Senior Lecturer in Global Health, International Child and Health Nutrition Research Group at Uppsala University. So, Meena, the floor is yours.
Thank you very much, Luz, for that introduction. And greetings from Uppsala, Sweden to everyone wherever in the world you are joining us from today. So it is really my distinct pleasure and privilege to introduce and demo this, the SHIFT framework, which is a health and nutrition equity tool for food environment transformations. But before I continue, I would like to acknowledge the contribution of my fellow working group members, as well as colleagues and other experts who have reviewed different versions of the tool over the last couple of years and provided valuable input. Thank you very much. So moving forward, I will start with briefly operationalizing two key concepts that are central to the SHIFT framework. First is what we would call the space of action for the SHIFT framework. Now, the focus of this particular tool is on the food environment and not on the whole food systems. So the food environment refers to the interface that mediates people's food acquisition and consumption within the wider food system. Now here, the model that you see here is an adaptation of the UNICEF Innocenti framework, which Sandro also referred to, and this is specific for children and adolescents. Now, the modified version that you see here shows the same framework as applicable to the population as a whole. Now, if you think about this, the space of action or the interface for where the SHIFT framework would function, that is marked within this red rectangle. It primarily includes the external food environment, which if we talk about, it's basically availability, pricing, quality and safety, marketing and regulation. And then also the personal food environment, which is mainly characterized by accessibility, affordability, and convenience, and of course, the interaction between the two. Now, this does not exclude the more upstream component of food production and supply, or the more downstream component of individual and household behaviors, or even the numerous drivers that you actually see around. So the different components, of course, they influence each other and they're influenced by each other. So the space that is shown here does not actually exist in isolation, which also means that the shift framework will not work in isolation. So it actually looks at the system, but it focuses on this particular space. And yeah, so continuing, going on to the second key concept is that of health and nutrition equity. And here I would like to just highlight the more functional role of the tool in addressing basically the differential needs, capabilities, opportunities, and resources at multiple levels that are actually needed in order to achieve health and nutrition goals. So the shift framework is built on a theory of change. Now, we have definitely not reinvented the wheel here. It is firmly grounded in the principles of health promotion and implementation research, and also aligned with existing and current initiatives and frameworks, such as WT Actions and Nourishing Framework, to name a few. Now, the theory of change actually outlines the problem and also outlines the inputs, activities, outputs, and outcomes that are required in order to achieve the impact, which is described as closing the health and nutrition gap by reducing the burden of food-related disease, mortality, morbidity, and risk factors. So the aim of the tool is to actively enable an equity focus throughout the transformative process. And this has been alluded to by the previous speakers as well, about the need for actually having an active equity focus throughout the whole process. And this and Shift Framework tries to enable this through three main components. The first is a 4-step process. The second is a compendium of good practices. And the third is resources. And as also mentioned by Luz earlier, this particular tool targets technical staff who work with health and nutrition issues. So this may be program managers, health and nutrition officers at municipalities, local regional administrations, so on and so forth. Now, the tool has been presented in the form of a framework that is user-friendly and that you can navigate to actually go through the different steps to access the different information as you go through the transformative process. The 3 components that I have mentioned, you can actually see them on the top of the menu bar when you go into the website. And this is also accompanied by an interactive PDF that is meant to support the users through the process. So starting with the first component, which is the 4-step process, we talk about 4 steps, which is basically map, engage, transform, and monitor. And each step is actually linked to guiding questions to guide the user through the process, and also good practice examples that users could be inspired to actually try out or modify for their own settings. As a user, you are free to actually enter this process at any step. It is not necessary to enter at step 1. So for example, if mapping is already done for your setting, then perhaps you need to start at engage or transform. That is the step that you need to enter the process. Now, for example, if you start with the step map, you will be able to access guiding questions in the interactive PDF, and you will also be able to access good practice examples from different parts of the world that you can draw inspiration from in order to achieve your goals. And the second component is the compendium of good practices. We have compiled about 70 good practices up to now, and this is by no means a complete list. So these good practices were selected based on 4 core criteria and 1 or more additional criteria. And as you can see, cost effectiveness is not included as that information is not always available. And hence we have chosen to actually call this as good practices as opposed to best practices. However, this also provides an opportunity for us as users to actually to promote some of these good practices and make them into best practices in our own settings through the work that we can use with the Shift framework. And this compendium of good practices can be accessed on the website in 3 different ways. So you can do a map search. There's a map search function. You can click on the dots and you will be able to access case studies that are specific to those particular settings, and there are descriptions on and also linkages to other publications from the case studies. You can also access the compendium through keyword search, or you can do a framework search. So if you want to access case studies that are very specific to a particular step of the 4-step process, then you can go directly to those particular case studies. And finally, we come to the last component, which is resources, which are categorized as advocacy, databases, and tools. So you can see some examples of the advocacy here, and then databases, for example, it could be like the global database on implementation of nutritional actions, the GINA database, or the tools like food system policy tools. So there's a compilation of resources that could be useful for users of the SHIFT framework. And that brings me to the end of the demo, but then the question remains of, so what? I mean, what next, right? So we have a follow-up event in Uppsala in October. Every year, the Uppsala Health Summit organizes theme-based workshops involving practitioners, policymakers, and researchers. Now, this year's theme is Healthy Lives from Sustainable Food Systems, and the workshops are organized from 25th to 26th of October this year. So SHIFT is we will organize a workshop on SHIFT as part of the Uppsala Health Summit, and the SHIFT is also currently being piloted in Tanzania through the Tanzanian Food and Nutrition Center. So we hope to actually present and discuss the results of our pilot efforts and also discuss much more in Uppsala. So most welcome to all of you to join us and continue these discussions further. Thank you very much.
Thank you, Emina, and thank you again for the great collaboration. The tool is coming together and is now being improved as we speak. Every time there is something new, there is something better. So we really appreciate that. Yeah. And now we'll hand over the microphone to Stefan, who will moderate the panel.
Thank you, Luz. So I'm Stefan Swartling-Petersen. I'm a professor at Karolinska Institute, which you see behind me here. Now we have a panel here, an exciting panel to actually see and get your views from the panel on whether we can actually promote equity this way by trying to transform a food environment. So together with us here we have Mr. Pierre Cook Jr. He's a technical advisor to the Healthy Caribbean Coalition. He's an ambassador of the One Young World and the Prime Minister of Barbados National Youth Parliament. We also have Dr. Francesco Branca, who is Director of Nutrition and Food Safety at WHO headquarters. And we have, as we heard before, Dr. Amandine Gard, Professor of Law at Liverpool University. You will find longer bios posted of these eminent people here in the chat. You'll also find a Q&A at the bottom there. So if you find you have a question to the panel, please type it in the chat and Jesse will help me keep track of that. So meanwhile, let me start now with Pierre. Pierre, on the UN Food System Summit, you were one among the loudest voices, or at least youth were, for advocating healthy diets from sustainable food systems. And here's another framework now called SHIFT framework, of which I'm partly responsible, but don't hold back. Is this going to be of any use to you guys as you push, Pierre?
Thank you very much, and thank you for the question. I think that it will be useful, and I'll tell you why. The SHAPE framework has taken an equity-based approach that is based in human rights, and a significant part of not only my advocacy, but the advocacy of many young persons is for us to take a human rights-based approach to interventions. And that's exactly for the reasons that Armandine mentioned earlier. It's because those instruments are rooted in equity and fairness, and they understand that vulnerable communities require specific interventions. And so as a citizen of a small island developing state, I understand intimately why we need to tailor our approaches to certain vulnerable communities. And when we think about young people and children, our food environment that we're exposed to is not something that we have control of. And that's what the SHIFT framework underscores the fact that we need to protect our children from predatory marketing, the fact that we need to protect our children from the influences of big food and big pharma in terms of what they consume. And so taking that human rights-based approach and looking at equity as a significant component of the SHIFT framework, I think that with the meaningful engagement of young people, that is a key ingredient that will propel this. The meaningful engagement of young people, I think the SHIFT framework can take us to a place where national governments, civil society organizations understand and implement interventions that are people-based and also ensure that across the board, everyone is represented and protected.
Thanks, Pierre. That's hopeful. So there's the potential that this could be useful. And one size doesn't fit all. So we need to look at those examples from around the world and contextualize it to our populations, if I hear you right.
Yes.
Brilliant.
Yes, exactly.
Now, Francesco, there's no shortage of WHO initiatives and WHO reports, etc. What role will SHIFT now play among your many compendiums, and what can it do for the nutrition community in your view, hopes and views? Francesco, please.
Hi, Stefan. Good afternoon, and good afternoon to all. So let me start by saying that in the vision of WHO is that we want to see a world free of malnutrition, where all people achieve health and well-being. And still, we see enormous inequities. I mean, geographical inequities. I mean, the progress in nutrition, in the achievement towards nutrition targets is really very slow in sub-Saharan Africa and South Asia. They carry the greatest burden. And then low socioeconomic groups in high-income countries have the highest burden of obesity. And then 3 billion of people in the world cannot afford a healthy diet. So clearly, the imbalances in food system are one of the major drivers of inequalities of health and nutrition. And that is clearly stated in the SHIFT framework. So I think the SHIFT framework is really very clear about giving this message. And I think that's the first important contribution. And I quote, policies that promote a radical transformation of food system need to be empowering, equitable, regenerative, productive, prosperous, and must boldly reshape the underlying principles from production to consumption. Now, WHO is working to advance the food system transformation and is pushing for 7 priority policy areas that will make diets safer, healthier, more equitable. And these policies are demonstrated as cost effective. They're largely of regulatory nature. And here's the public policy leadership Amandine was mentioning in her intervention. And they are fiscal policies, the regulation of marketing of harmful marketing, nutrition labeling, the interpretive one, improving food safety, public food procurement and service policies, food product reformulation, and food fortification. Now, clearly, the SHIFT framework can complement these existing initiatives and actions, and they can guide policymakers, program manager, and the wider nutrition community to design these policies so that they actually consider inequity in their design. So SHIFT helps understand the dynamics of inequity and help design the policies. And just let me give you a couple of examples. Interpretive labeling. I mean, unless we have that kind of labeling that everybody can understand, labeling is ineffective. Or your public food procurement policies, that's where we can actually make sure that the offer of healthy food is reaching everybody. And that requires a special attention, a special design. And so SHIFT is very helpful in that regard.
Okay, thanks, Francesco. So can I ask you again, what do you think about not making recommendations, but putting out a compendium of practices out there? Not even the best practices, but good practices.
I think we need both, because we need a very clear guidance saying this is the evidence and this is the cost effectiveness. So you can be sure that if you do this, you achieve that. But then the how is very important, because the context in which these policies are designed and implemented is very different. And so I think the good practices are extremely helpful to create that common understanding of how to, for example, address a number of bottlenecks. So the good practices are helpful to avoid somebody to say, oh, but actually it can't be done. it doesn't apply to our context. I mean, there's a lot now of very good experience in implementing some of these policies. Again, labeling is a very obvious one. There are many ways to do interpretive labeling, but we have very good demonstration that if you do that, together with fiscal policies, together with marketing, you have a shift in that. And everybody's been very concerned about the possibility of doing that. Now, we now have the evidence that's been done. So the good practices are absolutely critical for that policy transformation.
Thank you. So Amandine, thank you for your very good messages before, Amandine. Now talk to us about food environments, equity, and human rights. I mean, will someone soon sue their city government because their food environment is not healthy? Or can I sue a food company? We see these other things. So please talk to us, Amandine.
Thank you very much. Can I just, if I may, say something about best and good practice?
Please.
I'm all for it, provided that this notion of best and good practice is assessed against the evidence rather than some sort of dogma that let's say, for the sake of exemplifying what I'm saying, the European Commission determines that some substandard practices are best practice because we don't have better. So I think that must be really stressed. Who decides what best practice is and what's the yardstick? I think on food environment, human rights can have free contributions. The contribution regarding to the norms, what kind of substantive measures should be adopted to rebalance the food environments? And I won't repeat here what Francesco has just said. Secondly, there is the question, and Pierre was alluding to it, about the governance structures. What do we need in place to make sure that states are accountable? And this is where your question comes in, Stefan, whether we can sue a government. Well, I've talked about international human rights norms. We don't have the equivalent in international human rights law of the WTO, World Trade Organization dispute settlement body. So it's more difficult, but states are mandated to implement within their own countries international human rights norms. And this is where these principles of participation, empowerment can become more tangible. And there are some countries that allow citizens to take a government or a private actor, a food corporation, to court. And we've seen that around the world, in particular in Latin America, in Kenya, and other places. And finally, if I may, as I've mentioned, the World Trade Organization, and Francesco has mentioned interpretive nutrition labeling, I think the obligations that states have are not only individual obligations, there are also collective obligations. So if a state is effectively adopting a nutrient profile, a front of pack nutrition labeling system that is in line with what, say, WHO is recommending, then another state should, in my view, because of its human rights obligations to respect, protect, and fulfill, not challenge this state before the WTO Technical Barriers to Trade Committee, for example, a political forum where states are challenged when their legislation raises specific trade concerns. So I think we need to do more work to reflect on what these more collective obligations entail.
Thanks, that's helpful. But I'm so intrigued with the Germany and the Netherlands, where young people took their governments and private companies to court. Do you think we will see that for food environments and with the food companies soon?
I think we're seeing it already in some places. But the problem is I can make some statements about the normative value of international human rights law. It's more difficult to do it because human rights standards are implemented differently in with different constitutions. But I'll give you one example. IDLO is leading a project on human rights and healthy diets in East Africa. And we've reviewed the case law there. And in Kenya, there is a very broad standing in the constitution allowing individuals to challenge human rights violations. And one case involved PepsiCo that had not provided enough nutrition information. And the case was won by this person on the basis of the right to information as enshrined in the Kenyan constitution. Similarly, I moved to another part of the world. In Brazil, there was a challenge on a Shrek campaign, a marketing campaign using Shrek and the sort of licensed characters from the movie that constituted a tie-in offer. You buy some Shrek cookies and you get some toys, and the more you buy, the more toys you can get. And this was challenged. And again, the case against the corporation was won, and the appeal failed. So you do have
You're making me very excited.
Yeah, I tend to do so. Sorry, I should
Thank
stop.
you. No, but you're making me excited.
Good. If you are excited, that's good.
No, because I think we've moved on. We no longer only trust guidelines. We don't no longer only trust politics. We're moving on to judicial process, and we're moving on to activism, etc., to change. And I think we see the climate field is ahead, but it's interesting if some of these practices can come to this field as well. Now, Jesse, do we have some exciting questions in the chat? They're flying by and I can't keep track. Jesse, what's your top question and for whom, please?
So we have one from Maria. Thank you, Maria. So as Professor Gade explained the relevance of human rights-based approaches to advance healthier food environments, while other speakers have been referring to the equity framework to tackle this issue. What is the difference between these two frameworks conceptually? What are the pros and cons of using one or the other? And how are their frameworks reconciled in the SHIFT framework?
Wow,
a big
that's
one.
an essay.
Is that for me?
It might be a joint effort, so I think it might be for everyone.
Okay, I'll just say a few words. I think the human rights-based approach is very powerful because of its recognition of equity concerns, but the fact that it enshrines these equity concerns in law and mandates duties on states to promote equity. Of course, political will is difficult to galvanize, but I think there is something to be said for enshrining the human rights in law together with equity concern. It's too large a question for me to say much more, but
thank you.
I think equity is subsumed within human rights.
Thank you. Does someone else want to come in on this?
Maybe I just would like to remind us that we have voluntary guidelines on the right to food. They are clearly very, very important. And also, I think the Human Rights Council has been dealing with the issue. I mean, with the rapporteur for the right to food, producing very important, very impactful reports. I also would like to say that, in the context, for example, of the Convention of the Right of the Child, we were, starting to make some way forward, for example, on the reduction of pressure marketing food to children. So I think, we have spaces where human rights are extremely concrete, entry points for challenging the policy, the current policy environment.
Exciting. Pierre, do you want to come in?
Yeah, no, quickly, I just wanted to add that I think what we need, and Dr. Gard mentioned it a bit, is that political commitment to some extent, because we have governments in countries who've committed and signed on to the different instruments of human rights, so the Convention on the Rights of the Child, the Convention on the Elimination of Discrimination Against Disabled Persons, etc. But you don't see that reflected in the Constitution, and that is where we get the legal teeth to take the type of action that we're seeing in the climate sphere. And I want to see a bit more of that within our space. So as the human rights system enshrines those principles of equity. And so under that, we understand that if we commit fully, if governments commit fully in enshrining these principles in their constitution, then we know that people on the ground can have access to these rights. And even where they're being infringed, they can have legal protections through enforcing them through their national and international courts for the breaches of those rights in the Constitution. And that is what I would like to see.
Thanks, Pierre. So we need teeth to dig into food. Now, yes. There are many parables here. As we're discussing food now, I have one question where I want a short answer from each of the three panelists. We're talking about food here, and food implies ingredients. So I want one ingredient from each of you to transform food environments for better equity. So who'd like to go first? What's your ingredient to transform food environments for better equity?
I think I'll jump in data. I think data is very important.
Data.
And especially
Thanks, Pierre.
In my region, it's very important. Yeah.
Francesco.
policy commitment from local, national, regional, international policy commitment.
Wonderful, thank you. And Amandine, what's your ingredient?
States in the driving seats, not cooperation.
Wonderful. Thank you to the panel. Thank you to the audience. We're sorry about all the questions we didn't answer. I'll invite the panelists to answer some of them in the chat as I hand back to Luz.
Thank you so much. I actually will take a minute to thank the panelists. It has been a very good meeting and a great lively discussion. Now I will introduce Dr. Germana Lena to provide the closing remarks for today's launch event. Dr. Germana Lena is the Managing Director of the Tanzania Food and Nutrition Center, who will be coordinating the Shift Framework pilot project in Tanzania. Germana, over to you, please.
Thank you so much, everyone, for an excellent launch, and you have made my life quite easy. We began the launch with having information on why we decided that we need a new framework in order to address equity, and that this tool is really meant for technocrats in order to support them to visualize what they mean by equity and how they can use it to plan in their day-to-day nutrition programming. We then heard that there is a need to rethink the issue of equity, given the global challenge that we have recently seen with the COVID-19 pandemic, as well as with issues related to climate change and how these have affected our food system. Further on, the third speaker spoke about why the human rights-based approach is an important element to support nutrition programming and how this approach can be used to create more equity and equitable distribution of the benefits of nutrition in our different states. She emphasized on the human rights-based approach as a way to create a normative environment and to ensure that law is properly used in order to guide regulation and to protect its citizens with relation in relation to nutrition as well as health overall. And that we should be very cautious of the public-private partnership, because in one way or another, it might undermine the responsibility of the state to protect its citizens. Dr. De Maio provided us with a great perspective from Australia on how the SDG tracks may not be met in Australia, and how they have used different innovative approaches that are similar to the Shift framework in order to address the challenges, and that they are quite optimistic on the outcomes that they have seen and how they may actually, in the long run, reach their goals. And that local innovations are really important to drive local solutions, as well as addressing the various challenges that we may see in our food environments. Dr. Mina then took us through the Shift framework and how it was conceptualized in order to be a transformative tool in order to address the food environment. She took us through the theory of change on how it relies on the implementation science, health promotion theories, as well as the WT framework, amongst others. She took us through the transformative process, which is based on the 4-step process and the key questions that need to be asked, the compendium of good practice, and provided us that there are currently some case studies as well as literature on it, although I believe that more will be built on this as this framework continues to be used. She also gave us information on various resources that may be available or can be used, as well as the next steps, including inviting members of this webinar, as well as others who might be interested to participate in. We then went on to the panel discussion, and the key question was, can this framework be useful in order to address issues of equity in nutrition programming?
And I believe all three panelists unanimously said, yes. I could hear words of that this can protect the next generation. It is people-based. It is a clear message on the need for change of the food system to make it more equitable. There was more emphasis on why the human rights approach can contribute to norms and culturally acceptable practices, and eventually that the people need to hold their states accountable. Tanzania, yes, is planning to be the next, one of the first countries to pilot the SHIFT framework, and we are currently in the process of identifying nutrition officers who are placed at the regions and districts, and to ask their opinions on whether they see this tools and this framework as useful, how it can be used, what are the pros and cons, and how it can better be framed or improved in order to make sure that they are able to use it, and some of the glitches or troubleshoots that they see are there can be addressed. Finally, I think I'd like to invite all stakeholders, including us who are here, to share this knowledge to others so that we can be part of the discourse and ensure that all human beings have access to nutritious food that is adequate, safe, and that can promote good health. Thank you. Over to you.
Thank you so much. That was an excellent summary of the session. So I will just add that our gratitude and appreciation to Tanzania for testing this tool. You are an early adopter, and that information will be helpful for others. I will also thank all the panel, Dr. Naoko Yamamoto, Dr. Francesco Branca, Pia Cook, Dr. Amandine Garth, Stefan, Mina, and also I will take the opportunity to thank our WHO colleagues, Jesse Puyar, Lina Mahi, Jorgen Johnson, and Katrina Lundberg that have been involved in different stages of the development of this product. I will just say that the recording is available. It will be available on WHO's website. So we take the invitation to disseminate it further. So we will make it available in the next couple of weeks on our website. And I'm happy to see on the chat that there are people interested in testing it further and being engaged in the next stages. So thank you, everyone. Have a wonderful afternoon, evening, or morning.